Unit 7. Physiology and Injuries in Sports. After completing the study of the unit, you will be able to recognize the physiological factors determining the components of physical fitness, comprehend the effects of exercise on muscular system, know the effects of exercise on cardiorespiratory system, figure out the physiological changes due to aging, and identify and classify sports injuries. In human physiology, the functions of all the systems of the human body and their interrelationships are studied. It is only through human physiology that we find out how all the organs of our body work with mutual harmony. With the help of it, we get detailed information about cardiac abilities, functions of the nervous system, muscle institution, and emission. Physiological factors determining components of physical fitness. We all know that physical strength is determined by conditional abilities and coordinative abilities. Conditional abilities include strength, speed, endurance, and flexibility. Components that affect the components of physical fitness are strength, speed, endurance, flexibility, and coordinative abilities. Some physiological factors decides the strength, flexibility, speed, and endurance in every human being. The components which determine various physical factors of physical fitness are physiological factors determining strength. The factors which decide the physical strength of a human being are as following. Size of muscle. The strength of a muscle is directly proportional to the size of muscles. Unlike women, men are more powerful since the muscles are bigger than the women. Weight training, isotonic, isokinetic exercises, etc. augment the strength of muscles as well as increase their size. Morphology of the muscle. Each muscle is primarily made up of two kinds of fiber: fast twitch fiber and slow twitch fiber. Fast twitch fibers contract more quickly so they can produce more strength. Slow twitch fiber are determined on the basis of heredity. It can be increased through training. Body weight. In weightlifting, the weight of body and maximum strength are related to each other because the person who has more weight lifts more weight. Body weight increases the maximum strength of the body. Therefore, in sports like weightlifting and wrestling, body weight plays an important role in determining strength. Intensity of nerve impulse. The strength of muscles depend upon the motor units conserved in them. A stronger nerve impulse from the central nervous system, CNS, excites more number of motor units, and muscle will contract more strongly. Our body muscles have many motor units, and the strength of our muscles is determined by which motor units are activated. Coordination of muscle that participates in movement. In each and every activity, the two groups of muscles come into play, agonist and antagonist. When agonist muscle contracts, then the antagonist muscle remains relaxed. With the coordination of these two muscles, more and more strength is generated. Hypertrophy of muscle. Hypertrophy occurs when the working capacity of muscles gets increased and they become efficient in working continuously. Physiological factors determining speed. The relationship of speed primarily depends on central nervous system, and this is why speed cannot be increased much with training. Speed is a very necessary component of physical fitness, but it is not always possible to increase it in the same way as weightlifting or aerobics. It is determined through the following physiological factors. Explosive power. For a quick and powerful activity, there should be some explosive power in muscles. Apart from this, the explosive power depends upon the structure, size, and coordination of muscles. But through training there is a chance of improvement in the coordination and muscular size, which can improve the speed to some extent. Muscle composition. Every muscle is mostly made of two types of fibers: fast-twitch fiber and slow-twitch fiber. The proportion of fast-twitch fiber determines the possible speed of muscular contractions. In fact, muscular composition is determined by heredity and can't be changed through training. Elasticity and relaxing capacity of muscle. The elasticity of muscles allows them to move in a range which reduces the inner hurdles and in turn speeds up the activity inside the body as well as outside the body. Mobility of nervous system. In fast speed, and muscles contract and relax quickly. When there is fast contraction in agonist muscle, antagonist muscles get relaxed and motor and sensory nerves do their work efficiently. It is called the movement of central nervous system, which takes place due to reduction in speed for doing the fast and quick exercises. Biochemical reserves and metabolic factors. Training can increase the percentage of power and quantity in ATP and CP in our muscles which contract, i.e., adenosine triphosphorus, ATP, and creatine phosphate, CP, so we can state that biochemical reserves and metabolic power determine speed. Flexibility. Flexibility increases the range of speed. Whenever someone with a flexible body does a speed-related activity, they feel less strain in their muscles, which as a result conserves their energy. Physiological factors determining endurance. Endurance is the ability to do work even in the state of fatigue. This is the third main component of physical fitness. It is determined through the following physiological factors. Number 1. Aerobic capacity. For active muscles, their ability to maintain the proper supply of oxygen plays an important role in the performance of endurance. For doing any action, one needs the energy and power of muscles of supply can be generated in blood. This comes in the form of oxygen and nutrients. Aerobic capacity depends upon the following factors. A. Oxygen intake. The oxygen we get depends on our body capacity, which in turn depends on size of lungs, active number of active alveoli and breathing muscles. B. Oxygen transport. The transport of oxygen depends on the quantity of oxygen that is sent from the lungs to the body through the body's tissues or organs. C. Oxygen uptake. The amount of oxygen absorbed into the blood depends on the speed of blood flow through the lungs and the blood hemoglobin. It can be improved to some extent through training. The speed of the used up oxygen depends on mitochondria, their size and their metabolic capacity. D. Energy reserves. Aerobic power of the muscles depends upon the energy reserves of the body. So, it depends upon muscular glycogen and sugar in blood. It does not remain in body for more than 12 hours. For the long-term activities there should be reserves of liver glycogen and muscle glycogen. 2. Anaerobic capacity. Man's ability to do work in the absence of oxygen is called anaerobic capacity. The energy for these activities is obtained either through the breakdown of ATP-CP or through the presence of glycogen in muscles, according to the U.S. National Aeronautics and Space Agency, NIAS. Anaerobic capacity depends upon the following factors. A. Buffer capacity. It is the ability of the reserves of alkaline in our body that renders lactic acid accumulation ineffective. So, one does not feel fatigued quickly. B. Lactic acid tolerance. It is the ability of enduring the concentration of lactic acid in man's blood and muscles. So, a person can continue his activities for a long time. The lactic acid tolerance can be improved through training. C. VO2 max. This is the quantity of oxygen with active muscles used during exercise in 1 minute. VO2 max can be extenuated through exercise training. Number 3. Movement economy. A runner who can run at a given pace with less energy expenditure can continue with the same speed for longer duration. A good technique in endurance and sports can save energy. For example, using right technique in swimming, gymnastics, and running, one can save around 20 to 25% consumption of energy. Number 4. Muscle composition. An international athlete can have up to 90% slow twitch fiber and 10% fast twitch fiber in their body. Slow twitch fiber is necessary for endurance activities. It can work for a longer period of time and is the best for endurance sports like running, cycling, and powerlifting. Physiological factors determining flexibility. Flexibility refers to the range of movement in a joint or series of joints and lengthen muscles to induce a bending movement or motion. Flexibility depends on various factors and can be learned through training. Many factors can also be learned through diet and exercise. The factors which determine physiological flexibility are as follows. Anatomical structure of joint. Joint is composed of 2 or more bones which are bound by ligaments. Joint in our shoulder called the ball and socket does more movement as compared to other joints. The organ which moves a lot has maximum number of joints and organs such as heart, liver or kidneys. Age and sex. As we know that children have more flexibility as compared to elders. With the growth, their flexibility gets reduced, but through exercises, it can be increased or improved to some extent. It is also well-known fact that women are more flexible than men because men are more muscular. Muscular strength. There should be a minimum level of strength in muscles, which is instrumental in enabling muscles to do work even against the outside force. If stomach muscles are weak in sprints, feet and knees can't be raised to a particular angle or height. Muscular strengthening workout can become exhaustive in such people. Stretchability of muscles. The stretchability of muscles affects the movement or speed of our body. The stretchability remains intact when muscles are active. If the muscles are not used daily, the range of motion on joints gets reduced. Exercise can help to increase the stretchability of muscles in the body. State of an organism. When we wake up in the morning, there is reduction in the stretchability of our joints because the muscles are relaxed. But when we do a little warming up, the flexibility increases. Reduction in stretchability also occurs due to fatigue. Environment. Living in a high-temperature environment increases the flexibility of the person, whereas staying in a low-temperature environment reduces the flexibility of the person. Therefore, the body is first warmed up in sports. Injuries. The flexibility may decrease due to muscle injuries or tissue injuries, but after recovery, flexibility can be achieved by different exercises. Stretching muscles. Due to lack of physical activity on a regular basis, muscles become smaller, which results in the limited extension of joints, therefore decreases the flexibility of the person. Active and motionless lifestyle. Regular exercise increase flexibility, but it is eliminated due to no contraction and expansion of the gentle tissues and joints in an inactive person. Effects of exercise on muscular system. Exercises leads to changes in the muscular system, but these changes can only be felt if one does exercises regularly. Following changes in our muscular system can be seen if exercises are done on a regular basis. Increase in size of muscles. Exercising regularly increases the size of muscle cells, which also known as muscular hypertrophy. It is a long-term effect of regular exercise. Muscles remain in toned condition. Semi-stress is a condition in which the muscles remain a little contracted, i.e., they are in a condition to work. Due to irregularity in exercise, the toning of muscles slows down gradually, which decreases the ability of muscles. Correct body posture. By exercising regularly, the strength of muscle increases, which in turn keeps the body posture in correct position. Also, posture deformities do not occur. Increase activeness of fibers. Due to regular exercise, along with the active fibers of the body, inactive fibers also start functioning. That is why people doing exercise regularly are more powerful. Enhances body posture. Due to regular exercise, the muscles begin taking shape gradually. Due to fine shape of muscles, one looks attractive. That is why many film personalities and actors regularly exercise to look attractive. Delay in fatigue. Regular exercise can decrease the accumulation of fatigue-causing elements in a body like carbon dioxide, lactic acid, and acid phosphate. This results in increasing the ability of a person to work more without getting tired. Efficiency in muscle movements. Exercising regularly improves the efficiency of muscles movement. Increased strength of connective tissue. Exercising regularly increases the ability of linking the connective tissue together. As a result, the connective tissue are able to bear more strain and become strong. Reduce extra fat. Exercising regularly reduces the excess accumulation of fat in muscles. Effects of exercises on cardiorespiratory system. Cardiovascular system is made of two words, cardiac and vascular. The process of blood circulation in the body is carried through arteries and veins. Blood vessels which carry blood from heart to different parts of the body are called arteries, and veins which carry it home to the body's organs. There are two types of changes or effects that takes place due to exercise and training. 1. Acute immediate effects of exercise. Regular exercise results in immediate effects on cardiovascular system, like increase heart rate. In order to meet the increased demand of energy due to intensity and duration of exercise, heart has to work at a fast pace, which increases the heart rate. Increase in stroke volume. Stroke volume, the amount of blood ejected from the left ventricle of the heart on every beating, increases with increasing exercise intensity. In the normal state of relaxation, the stroke volume is between 50 to 70 milliliters per beat, while during intensive exercises, it increases to 110 to 150 milliliters per beat. Increase in cardiac output. Cardiac output is the volume of blood pumped from the ventricle per beat. It is the product of the heart rate, HR, or the number of heartbeats per minute, BPM, and the stroke volume, SV. The cardiac output of a normal person is about 5 liters minute. Increase in blood circulation. Due to exercise, the cardiovascular system delivers oxygen and nutrients via blood to all the tissues which needs immediate oxygen, and vice versa. Increase in blood pressure. Due to increase in the activity level, blood pressure also increases as it increases the pressure of blood on arteritis. 2. Long-term effects of exercise. Regular exercise also results in long-term effects on cardiovascular system, like cardiac hypertrophy. Exercising regularly increases the size and strength of the muscles of the heart. The walls of the heart also become stronger and thicker. Increase in muscle thickness of heart is known as cardiac hypertrophy. Increase in efficiency of heart. Due to regular exercise, the heart becomes more efficient. Thus, it is not necessary for the heart to beat quickly to pump blood for the body's requirement during relaxation. Increase in cardiac output. Regular exercise increases the cardiac output because during exercise the increased demand of energy is fulfilled by quick pumping of blood. Increase in blood circulation. During exercise, in order to supply more oxygen to the muscles, the blood circulation increases. Due to increased blood circulation, blood capillaries become wider, which improves delivery of blood. Controls blood pressure. Regular exercise reduces the high blood pressure. It helps to maintain blood pressure. Increase in blood volume. Increase in blood plasma volume by exercise also increases the blood volume. Red blood cells also increase in addition. Increase in recovery rate. Regular exercise increases the recovery rate rapidly. That is why after the acute physical activity, the rate of respiratory increase and recovery also becomes faster. Decreasing risk of heart problems. Regular exercise increases the size of blood vessels, which decreases the risk of heart problems. It also makes heart muscle strong, which increases the efficiency of heart. Increase in heart's weight. Long-term exercise strengthens the heart muscles of the athlete and increases the weight of the heart. Where the weight of heart of a normal person is about 300 grams, the weight of heart of a trained athlete is 500 grams. Decrease in heart rate. The total heartbeats of heart in a minute is called heart rate. Normally, men have a heart rate of 72 beats per minute, and in women, this rate is higher than men. If a person is trained for a long time, then his heart rate is 40 to 55 beats per minute. Capacity of heart. The capacity of the heart means the volume of the heart. The volume of the heart increases as a result of its size. Effects of exercise on respiratory system. The organs of the respiratory system like lungs, trachea, larynx and bronchi carry out the exchange of gases as we breathe. Few important effects are as follows. Increase in the capacity of lungs and chest. When a person does regular exercise, he needs more oxygen and his cells have to compensate it by breathing more, which leads to the exercise of his lungs and chest as well. Thus, it leads to an increase in their size and capacity as well as increase in physical activity. Increase in vital capacity. This is the quantity of air which a person through his effort inhales and exhales. In an ordinary adult, this capacity can be up to 3,500 cubic centimeters to 4,500 cubic centimeters. Through regular exercise, it can be increased to 5,500 cubic centimeters. Increase in residual volume. Residual volume is the quantity which remains in lungs after having inhaled out. If a person does regular exercise, he has more than normal quantity of residual volume in his lungs. Passive alveoles become active. Regular exercise makes passive alveoles active again because during exercise more oxygen is required, which open up blocked alveolus. Minute volume decreases. Minute volume is that quantity of air which is inhaled in a minute. When we do regular work exercise, it reduces minute volume. It improves the arrival of gases in alveoles. As a result, it supplies oxygen during inhalation. The condition of second wind almost finished. For an inexperienced athlete, it is a normal thing to take the second wind quickly. He who is experienced feels no need for the second wind. Regular exercise finishes the need for the second wind during work. Increase in endurance. Exercise helps in increasing endurance of the body. In a trained person, the intensity of breathing rate gets reduced. As a result, the trained person as compared to an ordinary person can do more work and for much longer time. Decrease in rate of respiration. Due to regular exercise, a person at rest experiences some reduction in breathing rate as compared to the earlier rate. Because there is an increase in the capacity of lungs, tidal volume, etc. So, even in less breathing rate, more oxygen is supplied. Strengthens diaphragm and chest muscles. Regular exercise strengthens diaphragm and chest muscles. During exercise, diaphragm becomes efficient in its work and the muscles of lungs get much space to enlarge. Meaning of aging. Aging is the state of life when a person's physical abilities and functional activities decline gradually. Old age is a phase of human life cycle in which the functioning of various organs and systems of the body begin to work slowly. Symptoms of old age in a person is decided by heredity and various environmental factors such as diet, exercise, social and financial status, etc. In easy words, it is inevitable and a slow process. These changes are usually seen after 30 years of age. Physiological changes due to aging. It has been proven by various studies that during the life of approximately 25 to 30 years of age, different body functioning is at its peak. As soon as the age increases, the work capacity and work efficiency decreases. Due to old age, following physiological changes occur. Changes in muscle size and strength. During aging, changes in the size and strength of muscles takes place, but there is an increase in total fat of the body. Due to change in the size of muscles, there is decline in their strength. This declination is often noticed during 35 to 40 years of age, but in the further years the tempo increases very quickly. Changes in metabolism and body composition. Due to aging, the capacity to work declines. Our needs related to energy also decreases, and as a result metabolic rate also declines. Fat gets stored under the skin. With increase in age, there is declination in body composition as well. This is the reason why fat gets stored, and as a result body becomes heavy. Changes in cardiovascular system. During aging, the strength of chest muscles gradually declines. With the passage of time, stroke volumes, cardiac output, blood volume, etc., decline. Blood vessels lose their flexibility to become stiff, which leads to increase in high blood pressure. Due to low blood flow, reduction in endurance takes place. The blood capillaries get less oxygen and nutrients. As a result, one feels tired soon. Changes in the capacity of respiratory system. With increase in age, reduction in the functioning of respiratory system take place. Decline is noticed in air passages, flexibility in lungs and their functioning. It leads to decline in their intake and uptake capacity, oxygen transport capacity, etc. The rib muscles get weakened. The capacity of taking a deep breath gets declined. The capacity of lungs taking oxygen gets reduced, which leads to low endurance. Thus, a person begins to feel tired soon. Changes in bone density. During aging, a man's bone density keeps on declining. This is the reason when a person in the age group of 40 to 50 years has a maximum risk of getting hurt in their bones. It takes place due to reduction in minerals in bones like calcium, phosphorus, etc. The joint of spinal bones starts becoming lean and the height gets reduced. Bone density declines. The process of declination in minerals begins to take place at the end of the 40s. Bones become weak and are more prone to injuries. Their capacity of bearing weight also gets reduced. Flexibility decreases. With increase in age, the flexibility of ligaments and joints reduces. Range of motion along with the reduction in flexibility strength of joints and their functioning also takes place. Changes in urinary system. With aging, the size of kidney gets reduces. As a result, the rate of blood being purified by kidneys gets slowed down. The capacity of bladder gets reduced and there is an increase in residual urine. One feels to urinate time and again, which leads to an increase in the chances of urinary infection. Changes in digestive system. With increasing age, reduction in the production of hydrochloric acid and other enzymes, digestive enzymes, and saliva from salivary gland takes place. As a result, the digestive system gets disturbed. One gets difficulty in breaking up food and its digestion. So, we can conclude aging brings out several changes in our body which affect the functional capacity of our body. Changes in nervous system. Many studies have revealed that reaction time and movement time slow up with aging. The capacity of doing work by central nervous system, CNS, also gets reduced, which affects the functioning of sensory and motor nerves. Loss in senses. With aging, man's sense organs stop to work efficiently. He loses the strength of seeing, hearing, touching, feeling, smelling, speaking, etc. because there is a prompt declination in the strength of sense organs. Sports injuries. Sports injuries refer to the kinds of injury that occur to the players during sports or exercise. In other words, the situation which occurs accidentally during physical activity, or when the player does not remain in the position of participating in the game or his physical ability decreases, is also referred to sports injuries. Soft tissue injuries. A soft tissue injury, STI, is the damage of muscles, ligaments and tendons and skin throughout the body while playing games and sports. Soft tissue injuries are of different kinds. Number 1. Contusion. Contusion is a muscle injury. It can result from falling or jamming the body against a hard surface. The discoloration of the skin is caused by blood pooling around the injury. Contusion is very common in sports like boxing, wrestling, kabaddi, etc. Number 2. Strain. A strain is an injury to a muscle and/or tendons. Similar to sprains, a strain may be a simple stretch in the muscle or tendon. Strain can be due to heavy weight lifting or excessive practice for the games. In case of complete tear, movement becomes completely impossible. Strain can be classified as A. Mild strain. In this type of stretch, there is a slight tension in the muscles without tearing of the muscles. B. Moderate strain. In this type of strain, the muscles rupture slightly, which also brings a slight decrease in its strength. C. Several strain. This type of strain results in complete tear of the muscles and lack of strength. Number 3. Sprain. A sprain is a stretch and/or tear of a ligament, a strong band of connective tissue that connects the end of one bone with another. The areas of the body that are most vulnerable to sprains are ankles, knees, and wrists. Pain, swelling, and inflammation are common in sprains. Sprains are classified by severity. A. Mild sprain. Slight stretching and some damage to the fibers, fibrils, of the ligament which resists the joint movement. B. Moderate sprain. Partial tearing of the ligament. There is abnormal looseness, laxity, in the joint when it is moved in certain ways. C. Severe sprain. Complete tear of the ligament. This causes significant instability and makes the joint non-functional. Number 4. Usually, it happens in kabaddi, basketball, and athletics. Abrasions are caused when exposed skin comes into contact with a rough surface. Number 5. Laceration. Laceration is the tearing of the skin with a sharp object or by impact injury from a blunt object or force that result in an irregular wound. They are more dangerous than incised wounds. In most cases, tissue injury is minimal, and infections are uncommon and poisonous. Number 6. Incision. Wounds are places on the body where a sharp object or pebble stone enters the body. The wound depends on the edge of the object, and it is a top-down injury. Sometimes nerves and veins get damaged in incisions caused by the sharp edges of the objects. Number 7. Bruises. The affected area turns blue by this injury. The blood spreads under the layer of skin as the blood vessels of the place gets broken or damaged. This can happen in a variety of ways such as a direct blow to the skin or a fall taken against a hard surface. Hard tissue injuries. Injuries to the skeletal system are called hard tissue injuries. They include fractures and dislocations. Types of hard tissue injuries. 1. Dislocation of bone. 2. Fracture. Affected organs. Bone, joints. Reasons. High-impact sports injuries, forceful and unnatural movements. Fracture. Breaking of bone is commonly called fracture. A mild fracture is also known as hairline fracture. Number 1. Simple fracture. When the bone dislocates without any wound, it is called simple fracture. This kind of dislocation can usually be caused due to slipping or collision with someone. Simple fracture heals naturally in few weeks and does not need medical attention as it is a normal injury. Number 2. Compound fracture. A compound fracture is a fracture in which there is an open wound or break in the skin near the site of the broken bone. Most often, this wound is caused by a fragment of bone breaking through the skin at the moment of the injury. Number 3. Complicated fracture. A complicated fracture is a fracture in which structures surrounding the fracture are injured. There may be damage to the veins, arteries or nerves, and there may also be injury to the lining of the bone. It usually happens to high jump or pole jump players. Green stick fracture. It is a small, slender crack in the bone. This usually occurs in children less than 12 years of age because their bones are more flexible than an adult's bones. Number 5. Comminuted fracture. When a bone is shattered into more than 2 pieces. This type of complicated fracture is called comminuted fracture. It can occur to the players in cycle or motorcycle race. Number 6. Impacted fracture. An impacted fracture occurs when the broken ends of the bone are jammed together by the force of the injury. Number 7. Stress fracture. A stress fracture is a small break in the metatarsal bone, which carries the weight of the body. Most stress fractures occur in the bones of the foot and lower leg. It is usually a very painful fracture and occurs mainly in long races, basketball, and weightlifting. Number 8. Transverse bone fracture. A transverse oblique bone fracture is a specific type of broken bone where the break is at a right angle to the long plane of the bone. It usually occurs in the upper and middle part of spine and also in the lower back. Number 9. Oblique bone fracture. An oblique bone fracture is characterized by a break that is curved or at an angle to the bone. It usually occurs in long bones like humerus and femur. Joint injuries. A dislocation is an injury where joints in a joint are dislocated by contact with the ball, the ground, or another player. Dislocations can occur in contact sports such as football and hockey and in sports where falls are common, such as downhill skiing and gymnastics. Types of dislocations. Number 1. Dislocation of lower jaw. A dislocated jaw is occasionally caused when chin collides with a hard object, but it is typically caused by opening the mouth excessively wide. Number 2. Dislocation of shoulder joint. A dislocated shoulder is an injury in which your upper arm bone pops out of the socket that's part of your shoulder blade. Shoulder dislocation is a common injury in contact sports, such as football and hockey. A hard blow to the shoulder is also a common source of dislocation. Number 3. Dislocation of hip joint. Hip dislocation occurs when the head of the thigh bone, femur, is forced out of its socket in the hip bone. It typically takes a major force to dislocate the hip. Number 4. Dislocation of wrist joint. Any kind of traumatic injury to the hand or arm can result in a dislocated wrist. Common causes of these injuries include high-impact sports, such as football or hockey, or breaking a fall with the hand. It can be very painful. Types of dislocations. Number 1. Dislocation of lower jaw. A dislocated jaw is occasionally caused when chin collides with a hard object, but it is typically caused by opening the mouth excessively wide. Number 2. Dislocation of shoulder joint. A dislocated shoulder is an injury in which your upper arm bone pops out of the socket that's part of your shoulder blade. Shoulder dislocation is a common injury in contact sports, such as football and hockey. A hard blow to the shoulder is also a common source of dislocation. Number 3. Dislocation of hip joint. Hip dislocation occurs when the head of the thigh bone, femur, is forced out of its socket in the hip bone. It typically practiced during fatigue. The study found that if a player cannot predict any physical or mental condition, then it increases the likelihood of injury. Lack of sports facilities. Proper sporting facilities and sports injuries are very closely related to each other. Due to lack of sports facilities, the likelihood of injury during the game increases a lot. Such as if the track is not flat during the race, the runner may fall and it can lead to various injuries. Injudicious officiating. If a player or officials do not conform to the rules or discriminate against any one team, then such players do not follow them properly. Unscientific method of training. The player should have complete knowledge about the scientific undertraining. Due to lack of knowledge of scientific rules, the player is always in danger of being injured. Lack of fitness. If the player is not physically, mentally and psychologically fit, then he is likely to face injuries during training of sports at all times. Someone has rightly said, An unfit individual is more prone to injury in the field of sports. Lack of nutritional elements. Due to the lack of nutrients in the food, players may also be injured. For example, if a player consumes food containing low calcium and phosphorus, then lack of it could lead to an increased risk of fractures during practice. Pressure to perform. If there is more effort put in by a player than his body permits, the chances of injury are increased. Recurrence of injury. If a player starts taking part in the games again without getting his previous injury healed completely, it increases the chances of recurrence of injury. Improper sports equipment. Many times, injuries are caused by improper sports equipment.